Hello, uh, my name is Daniel Beke. I'm a student of Celsius University, class of Nurse NUR 290. So, I want to talk about my reflection on my experience in class over over the years and my experience at the clinic as well. So, first of all, I want to be grateful to God Almighty for bringing me to this point in this program. It was looking as if it was not going to I was not going to reach the finish line, or should I say, the final cost 290. But look at me now, I'm at the edge of graduation, and I'm very grateful to God for that. And I also want to thank my instructors that have been there for me, supporting and encouraging me. And the same goes to my advisors also. At every difficult moment, they're always there to, make things easier. And I was able to skate through from every difficult moment. And also my amiable mom, who is my spiritual mother and physical, and give me all the physical support as well. So everything about the ADA program is going well for me, such as my grades, my lectures, lecture materials, and I'm doing very well in my exams. And also, the program has been able to expose me to some innovation in the practice of nursing in this modern era with advanced technology in the care of patients. So, my experience during the clinical interview was I will never forget because it made me to understand the diseases and the situation of a patient and how the patient feel, what help can be rendered to the patient, and and also it's usually a patient-centered care with main goal is for the patient to be able to, to be able to do her ADL, and the patient had a diagnosis of Crohn's disease, and it was a privilege for me to do like a head-to-toe assessment on the patient, particularly on the abdomen. And this patient had IV antibiotics, and the focus assessment was inspecting the stomach, auscultation, percussion, and palpation. She felt more pain on the right lower quadrant, which is expected for a patient that has Crohn's disease. And she was on a clear liquid, low diet. She was taking broth. She was on antibiotics and medications such as steroid, like immunosuppressants, and pain medication because she felt more pain, cramps, and nausea and vomiting. So all the symptoms of gastrointestinal was being felt, and there were medications for it. So the what confirmed diagnosis was CT scan on the stomach, and also the antibiotics, the medication was mostly IV piggybacks, IV push, and some PO meds like Tylenol and nausea medication and all that. So, all right. So, at the initial instance, I was having anxiety and my nerves were wrecking because I didn't know what to expect, and I became more relaxed when I got to know that the patient will be working with. I understood what was expected of me, such as doing her initial vital signs, doing her head-to-toe assessment, medication administered as IV piggybacks, heparin, IV push, and others, like pain medication. So this helped me to appreciate the importance of nursing, and also to put a smile on the patient to reduce the pain in her abdomen. And I was able to accompany her psychology because she's a guardian patient. She loves to go to the garden. So there's a garden at the hospital where we went there, and she was very happy about it, and she felt very much relief. Everything went well as planned. The care plan was followed amicably, such as ensuring that she has the right diet with low residue and clear liquids, and exercises. She was walking around every morning, walking around with her IV pole and all that. And also the labs were drawn for CBC, BMP, and to make sure that the electrolytes are not whacked out, because she was vomiting, she was having diarrhea, so you should expect a depletion of the electrolytes. And so we're able to avoid triggers that could trigger the pain and the cramp, and every step was achieved. All the team went hand to make sure that she had the proper care, such as the dietitian, such as the nurses, the nurse practitioner, the doctors, and all other things as well, the nurses aid, and so on and so forth. So she was actually diagnosed with Crohn's disease, like I said, which is a pain felt at the lower quadrant. So she was initially, why the confirmation was that she was initially admitted in a hospital, so nobody knew what was going on for gastro issues. But later on she came back and it was not relieving, and this time around they were able to diagnose her of having Crohn's disease. So which brings us to the time of management, you understand, and which everybody was on deck to make sure to ensure about that. So putting skills into practice makes a competency of practicing knowledge and all that. So that was the situation.